scientific evidence-based approach. So I make sure to draw on both aspects and incorporate that into my treatments as well.
Okay, perfect. And we're actually going to talk a lot in your segments here, but I guess first off and foremost, tell me what acupuncture is about.
Well, most people know acupuncture is inserting needles into the body. I brought my little Acuman here.
Yes, you brought in a very lovely, I guess, a model of
yes.
Where the different points are where you can do acupuncture, right?
Yes, so earlier we nicknamed him George, so I will identify him as George. These little black dots here, they indicate acupuncture points on the body. So as you can see, they cover the entire body. There's some on his head, there's some on his face, his arms, his torso, his legs, his feet. There's literally an acupuncture point everywhere on the body.
Yes, because I know the camera may not be able to pick up every single point, but there are like a lot of acupuncture points on this.
There are over 400 acupuncture
Over 400.
points
I mean, it's just totally incredible to know that every spot on your body controls
some aspect.
Right.
Exactly. So these lines here, they indicate acupuncture meridians, so they're the channel pathways. Mm-hmm. So more from a traditional Chinese medicine perspective, that if you needle into these acupuncture points, you are promoting the flow of qi through the body.
Now let's just talk a little bit about qi, Amanda, because it is sort of, to some, is a very foreign word. What does it mean exactly?
Well, in our culture, we don't really understand qi or the sort of energetic component to it. But what's really interesting is that after studying the medical acupuncture perspective, you can see the similarities both through the Chinese medicine as well as the Western medicine viewpoints on acupuncture. So in more terms that we would understand, acupuncture points are actually nerve bundles on the body.
Nerve bundles. Okay, that's a good way
of making it seem more, valid.
A little simplistic, yeah.
So nerve bundles are areas on the body with high neuroreactivity, which means that needling into them or pressing onto them, a lot of people refer to them as pressure points, and that will actually change abnormal function of the nervous system. So you're directly corresponding and communicating with the central nervous system and the peripheral nervous system, which is the powerhouse of the entire body.
Okay. So before we get into sort of the details about acupuncture, what type of clients should get acupuncture? Because some people are kind of a little bit turned off by it in terms of, how it looks with the needles going into the body. So what type of clients would you say need it?
Anyone can benefit from acupuncture. Most of my clients are usually late teens all the way up to 80 years old, anywhere in between. Kids, you can do acupressure on them, so it's stimulating the acupuncture points with your hands and your fingers and massaging them.
I mean, how young in age would you recommend kids getting
You can treat infants as well, not with needles, with acupressure. Needles, right. So babies love to be touched. So you can massage them and massage the acupuncture points, and then they can get the benefit that way as well. Because they're so young, they're very sensitive to the treatment, so they respond really quickly. Okay,
so I know you brought a few examples here of different, I guess, services that acupuncture that you do through acupuncture, right? Well, I guess if you can just explain this first.
So a typical treatment will include needles, the patient lying on the table with needles in them for about 20 minutes.
Because that's more the traditional image people get of acupuncture. Okay.
So I have brought some other things with me that I also incorporate into the treatment more as an adjunct to the treatment. So the main treatment is the needles, but these are some things that help after. So with me here I have cups. These are glass cups. They're used for a technique called cupping. A lot of Olympic athletes you would have seen at the Summer Olympics had these round bruises on their backs. That's from cupping. So what it is you are heating the air inside the cup and applying it to the skin. This creates a vacuum. So what happens is it sucks up your skin and all the underlying tissues into the vacuum. You can leave the cup on the body, and that's what will result in the bruises. Or you can do a technique which is called moving cupping, where you actually slide the cup up and down the body.
So when you talk about the bruises, I guess we should just clarify, does it hurt?
It doesn't hurt.
Okay,
no,
so what's the sensation that people feel? Because I mean, it's hard to see, but this is a pretty solid glass cup, right? So what happens exactly, and why does it leave sort of the markings and the bruises?
It leaves the bruises because you're creating a vacuum and a suction. So what happens is you're bringing all the toxins up to the surface of your body, so your circulatory system and your lymphatic system can remove them from your body. So it does leave a bruise, but it is temporary and it's a good bruise. It doesn't hurt to get it. It's similar to getting a deep tissue massage. So it actually feels really good.
Okay, so let's just move on quickly to another thing that you brought in here, Amanda. What is this exactly?
This is an electroacupuncture machine. This is one of my favorite things to use in treatment. I'm one of the best investments I've ever had. So I don't introduce this right away into the treatment. I like to just do regular needles first, just to get a gauge of the patient's rate of response. So I'll introduce this more on the third or fourth visit. Basically, we have these little leads here, and when the needles are in, I'll clip these little alligator clips to the acupuncture
to the actual
needles.
needle?
Yes.
Oh, okay.
So it will send a constant stimulation, and you feel sort of a tapping sensation in the tissues. So sometimes we want to get a muscle contraction. So we're actually needling into the motor point of that muscle to relax it, and the muscle will actually contract and twitch. Other times, depending on the setting, we can just put it on a low setting, which will cause release of different hormones into the body.
So in more simplistic terms, what is the benefit of this machine here?
Electroacupuncture is more of a stronger stimulation. So if you're responding just to regular acupuncture, you won't need it. But it's really good for treating any kind of musculoskeletal neurological conditions as well, like sciatica.
Yeah. Okay, so when we come back, more on acupuncture. Stay tuned.
Are you looking to create awareness for your business and increase sales? Sponsorship advertising on Rogers TV is an effective way to promote your business with high-frequency exposure at the lowest industry rate. Rogers TV provides a unique targeted marketing strategy by placing your ad on the programs that best match your demographic. And we produce the advertisement at no cost to you. Rogers TV reaches over 500,000 potential viewers in York Region. Find out how you can reach your target market through cost-effective promotion on Rogers TV.
Here are a few tips from Rogers Pumpkin Patrol for a fun and safe Halloween night. Wear a properly fitted costume that is bright and non-flammable. And sew reflective tape on your costume so you can be seen in the dark. Use makeup or enlarge the eyes on your mask so you can see well. And when wearing a mask, push it up on your head while walking. For more safety tips, visit pumpkinpatrol.com or rogerstv.com.
Welcome back to the show. Tonight we're talking all about health and wellness. So Amanda, before the break we were talking about in detail about acupuncture and the different techniques like cupping. I want to know, I mean, because people's fear, I guess fear or concern about acupuncture is that it hurts.
Yes.
Right?
Yes.
But does it really?
No.
Okay.
Unfortunately, the fear is what prevents a lot of people from trying acupuncture in the first place. So usually people's initial response when I tell them I'm an acupuncturist, the first question out of their mouth is, does acupuncture hurt? And the answer is no, it does not hurt. When people hear the word needle, they associate it with needles to get blood taken out or a vaccine. So those are hypodermic needles. And the difference is those needles are hollow. So they actually cut the skin when they're going in, and that's why they hurt. Acupuncture needles, on the other hand, are solid with a round edge. So they actually just gently part the tissues out of the way when they're inserted. And they're actually extremely thin and extremely fine. So
I know you brought some examples, right, Amanda? If I can just hold it up here, because they're very fine and delicate. But if you don't mind explaining, I guess, the difference between each one.
So just to show how thin these acupuncture needles really are, you can see how flexible they are. They actually bend. They're so thin.
And it's interesting when you bring up the point that it's not hollow, so it won't cut the skin.
Right. So it just gently parts the tissues out of the way.
And how about the middle? Like, what are the differences between the different needles?
The major differences with the needles, you're looking at either the size or the gauge of the needles. So the length of the needles, these ones here are 1.5 inches. These ones here are 1 inch. And these ones here are 1/2 inch.
Okay, so they do look a little bit bigger.
They're shorter,
yeah.
Yes.
Oh, shorter, okay.
So it just depends on the area of the body that you'll be needling into that will determine the size of the needle that you choose.
Okay, so take me step by step. When a client first comes in to the center and they want to see you about acupuncture, what sort of assessment do you put them through?
Well, the most important thing to having a good treatment is to do a good assessment.
Okay, yeah.
So you can't go anywhere if you don't understand exactly what's going on with the patient. So I will do a very thorough assessment on the patient. So even if you come in complaining of headaches, I'm still going to ask you about your other systems in your body. So we'll look at your digestion, your appetite, your bowel movements, your sleep patterns, your energy, your menstrual cycle, and all those things will give me little clues as to the cause of your headaches. So not every patient that comes in the clinic complaining of headaches is going to get the same treatment. There's not a blanket treatment. All the treatments are individualized to each patient.
So you really do take the time to go through sort of their medical history, I can imagine, right?
Even things that people don't think are important actually make a difference. So I try to tell my patients, just any subtle little thing, even if it's unrelated, let me know because it probably means something.
So why should people choose, acupuncture as a form of therapy compared to other, I guess, therapies?
One of the benefits of choosing acupuncture versus other forms of therapy is that we're trying to provide a solution to your health issues. So we're not just writing a prescription of painkillers and trying to mask your symptoms, but we're actually trying to correct them on a deep physiological level so that once they're gone, they stay gone. And it's not a recurring issue that you're going to have to keep dealing with. So, there are certain people that always say, oh, I have a chronic back problem, and
you hear it all the time.
It's too common, or I get headaches, and they're just resigned to the fact that they have headaches that come once a month. But you shouldn't be dealing with that. So if you actually go through your entire system and find out dysfunctions in certain areas of the body, you can identify those dysfunctions but correct them, and then you won't have those issues anymore.
Oh, so besides the sort of the chronic, back conditions some of your clients have, what other conditions could acupuncture treat?
Most people associate acupuncture with back pain, neck pain, migraines, but they don't realize that acupuncture can treat so many other things. They can treat fertility, women's health issues. They can treat insomnia, sleep disorders. That's one of my favorite things to treat, actually. Any kind of digestive issues, so Crohn's, colitis, IBS, chronic constipation, chronic diarrhea.
That's just a slew of sort of types of illnesses or conditions you can treat.
Yeah.
But, I can imagine this doesn't happen overnight, the treatment. So is it sort of a case-by-case, individual by individual, could need a longer treatment?
Depending on how long the patient has had the condition will determine the length of the treatment plan. So something that's more acute, that is more recent, is easier to treat than someone that's been suffering with something since they were a child. But that doesn't mean there is no hope. It just means they'll need more treatments. And it depends on the patient's sensitivity level too. So some people respond really quickly to treatment and some people take a little bit longer.
Now, you mentioned insomnia.
Yes.
One of your sort of most common or most popular conditions to treat. Why is that? You said is, I guess, one of your favorite.
You know what? Before I started, I didn't realize how common it was.
Okay.
So a lot of people come in, and if their chief complaint is back pain, they've usually checked off insomnia or sleep disorders on their intake form at the same time. So it is extremely common, and with acupuncture, it's good reward with it. There's good benefit to it. So a lot of people don't think that they can actually get treatment with it, and they don't actually seek care because they just identify themselves as a bad sleeper.
So, I mean, I don't know if you can point out where, you know, you would trigger or pinpoint this insomnia if people were suffering from insomnia. Can you see it, or?
Well, it really has to be geared specific to each patient.
Okay.
So there's not really a blanket treatment, but there is one spot right in the middle of your forehead. It's called yin tong, and it's one of the best points to help calm the mind. So usually people that have trouble sleeping, it's because their mind stays active, and they can't actually stop their mind to go to sleep at night. So there's a point in between the eyebrows that's a good spot to
I
needle.
see that a lot, like, yeah, I guess, you know, on television or whatnot, that point.
Yeah.
That is
It's
sort
a popular
of a popular
point to
point,
needle.
right, is what I'm trying to say.
Yeah, it's
Okay.
popular.
And besides insomnia and back pain, just quickly, what other sort of popular ones?
Fertility is actually a big issue. So a lot of patients will come in if their fertility doctor, if they're doing IUI or IVF, will recommend that they get acupuncture as an adjunct to their treatment as well.
Okay, so when we come back, I know you're going to talk more about acupuncture.
Yes.
And more about the services that are provided at the clinic. So stay tuned.
Hi, I'm Mark Vasilius. Join me for Your Money in Real Estate. We'll talk about the legal ins and outs of investing. That's on Your Money in Real Estate, live Wednesday, 7 p.m., only on Rogers TV.
Hi, I'm Elaine Spencer.
And I'm Jeff Moore. Thursday on Daytime, we get to cook a meal with meal planning expert Sandy Richard. Sandy is the best-selling author of 1, 2, 3, 4, 5, yes, 6 cookbooks. She is a TV host all across North America, and most importantly, she's the mother of 7. If there's anyone out there who can teach us a thing or two about being organized in the kitchen, sure must be Sandy.
Sandy is promoting her new cookbook, Anyone Can Cook Dinner. We get ready for Halloween with a scare for a good cause. We'll get a visit from the owner of Mira's Haunted House in Holland Landing. This maze and haunted house was created to raise money for a little girl that's going through cancer.
Also, Aaron Steller, founder of Aim to Walk, a neuro rehabilitation facility, will be here. He'll introduce us to a new device called
Rehabtronics.
All right, this device helps people with movement impairments resulting from stroke, spinal cord, and other brain injuries.
And we learn to make creative cards and unique crafts with Stamp It Up. That's Thursday on Daytime.
Welcome back to In the Know. Tonight we're talking all about health and wellness. Now, Amanda, before the break, we were talking about some of the conditions acupuncture could treat.
Yes.
And I know infertility is something that you mentioned. Is
Yes.
that a really more of a common condition you see
Yeah,
amongst women?
it is
couples?
pretty common. Most people will either be recommended by their fertility doctor to come and use it as an adjunct to any of the assisted reproductive technologies that they're undergoing, or other people will just pursue it on their own if they're trying to conceive naturally. It's also good for miscarriage prevention too. So some people don't have an issue getting pregnant, but they have trouble staying pregnant. So we can gear the treatment to prevent miscarriage as well.
I mean, it is a really emotional,
Roller
issue
coaster.
for a lot of women and couples out
Yep.
there. And I know you brought in a favorite saying of yours when
Yes.
it comes to this issue, right?
So one of my favorite things that I tell my patients is that the body will not conceive if a woman is not in a healthy enough state to support a pregnancy. So a lot of times women are diagnosed with unexplained infertility. So that means that they're menstruating regularly, they're ovulating, their hormone levels are fine, functionally, mechanically, everything in the reproductive system is okay. So they're being told, we don't know why you're not getting pregnant. But the truth is, with acupuncture, there usually is an explanation, and it usually lies outside of the reproductive system. So that's why
it's a big revelation when you say it that way, because it could be very frustrating for women, right? They don't, like you just said, it's unexplainable. So take me through sort of a typical treatment you would give a woman who is experiencing infertility issues through acupuncture.
We focus a lot on the abdominal area, so we will needle in the lower abdomen into the uterus area. The goal there is that when you needle into those tissues, it causes vasodilation, which means the blood vessels are expanding, and that causes more blood flow to the area. So your muscles,
which is a good thing.
Which is a good thing. So we want to send all your energy, all your blood to that area. So going back to the quote that I was saying is that if your body is not in a healthy enough state, it's not going to make reproduction a priority. So if there are other things off in your body, so something so small as you having constipation and headaches, that could be enough that your body is putting all its attention and all its resources on treating that, and it's not thinking about reproduction. So a typical treatment will go through your entire system, your entire body, and try to find any kind of dysfunction outside of the reproductive system, because that could be contributing to why you're not getting pregnant.
And it's, I mean, when women think about this area and putting, needles there, completely safe. I mean, obviously you go through with your clients, in detail what will it trigger and what, and if it will hurt or whatnot, right?
Exactly. So it is definitely a safe area to needle. There's actually not much sensation there, so you really don't even feel much when the needles are in.
Now, this is the last segment of the show, and I know you wanted to talk a little bit about AcuDetox. Is this sort of like a new term, a new thing?
It's not new,
in the field?
but I think it's gaining more in popularity. The AcuDetox was used heavily post 9/11 for the firefighters who were dealing with post-traumatic stress disorder. So what they did was they set them up in a room, and they needled everyone at the same time, all in the ears, to help them deal with the stress and the anxiety of what they had to go through. But it was originally created for treating addictions. So drug addictions, alcohol, smoking is a big one that I see in my clinic. And all it is using the ear and providing 5 needles into the ear at specific sites to reduce cravings and withdrawal symptoms.
Okay, because I know you brought in a model here.
Yes.
So our camera will get that, but if you can explain, in more detail those main trigger points.
So the ear is considered a microsystem of the body. So if you've ever had reflexology and they work only on your feet, the foot is also considered a microsystem. So you can image the entire body onto the ear and identify certain structures on the ear and treat it by only needling into the ear.
It's just so that small part of your body. It can it controls a lot.
A lot.
Okay.
Yes. So I'll needle into the ear, but I also brought with me here, these are ear seeds. And what I do is I'll tape them to the patient's ear. So it's something
you could just hold it up there. I mean, it's very tiny.
They're extremely tiny. They're ear seeds, and they're just taped onto the ear. So they're taped onto the acupuncture points on the ear, and it's something that patients can do in between sessions. So it will help to prolong the treatment. So if a patient is trying to quit smoking, for example, I don't see them every day. So they need some support on the days that they don't see me, and that's where the ear seeds come in. So I tape them to their ear, and when they're having a craving, they can press it, and it will help to reduce their craving and reduce some of the withdrawal symptoms that they're experiencing.
So you mentioned addictions and smoking. I mean, how long is the treatment? Because I mean, to be able to help or even cure smoking is such a huge thing for many people. So how long typically is the treatment for that type of addiction?
For smoking, it needs to be combined with willpower. So acupuncture is not going to give you the motivation or the desire to quit. You obviously have to want to quit in the first place. So it usually takes anywhere from 10 to 12 sessions to actually eliminate all the cravings and to have patients quit. But they have to have willpower on their own. One of the interesting things is that patients who use acupuncture to help them quit smoking usually don't start again. So once they've quit, they're done.
Wow, that's what you found with your clients that you've seen.
Yeah.
Okay.
Yeah.
So what other types of, I guess, conditions would you treat using AcuDetox then?
I usually will just throw it in. So I'll do a body treatment and then I'll throw some ear points in as well, just to strengthen the treatment, to enhance the treatment. The smoking has the most points in the ear, but I'll throw in points to calm the mind, promote relaxation, if I'm treating a patient for something else too.
Because I know some friends who have, sought out acupuncture, and they've gotten the needles around their head and their face. They're sensitive about the ear because some of them were saying it causes a lot of heat in the ear. Is this a common side effect, or
you might feel a sensation of heat or warming in the ear, but that's a good sign because it shows that your body's reacting to the treatment. So it means that you're responding to the treatment. So they might feel a little bit warm while the needles are in.
Okay, we just have a few more minutes left in the segment,
Yes.
Amanda. So I just want to sort of go back to some of the common conditions you see. Headaches.
Yes.
I know we talked about it briefly before, but if you can go back to it and talk a little bit about how you treat it.
Headaches are huge. The most common type of headache I see are called tension type headaches.
Okay.
So this all comes from the muscles in your shoulders, your upper trapezius muscles, as well as the levator scap muscles, so the back of your neck area. And this is from people on their computer typing like this, from driving. So it's when your shoulders come up around your ears that they get really tight, and the muscle attachment connects onto the back of your skull. So when that muscle is really tight, it pulls on your skull and it causes a headache. The referred pain pattern is also up into the forehead, above the eyebrows. So a lot of people think this is from squinting at the computer screen, but it's probably coming from the shoulders and the neck area.
Okay, so I mean, just to wrap up, what can you tell people? What is sort of the takeaway message to viewers out there who would like to seek, more of a holistic approach to their health?
I would like to let patients know that prevention is key. So you don't have to be sick or have a condition to benefit from acupuncture, but you can come in and get an assessment and work on your whole body, the wellness component to it.
Okay, thank you so much, Amanda,
Thank
for
you.
joining us on the show, and to your other colleagues that joined us earlier on the show
Yes.
from the Holistic Health Center in Vaughan. Thank you for watching at home, and I'll see you next week on In the Know.
Call the Rogers TV viewer response line at 905-780-7114 or email us your comments.
Babies need lots of your loving care and attention for healthy development. Encouraging smiles and smiling back, picking them up when they cry,